Hi YouTube, this is Sherry, S Loves Weight Loss, and I'm doing this video. I wasn't going to do this, but I'm a subscriber to Proof Weight Loss Works, and their topic for the week was regain. And as I was watching the daily videos, no one who taped had ever had a major regain, except no one really had a major regain. So, this is a topic that I have yet to really see on YouTube. There's one lady that I belong to, and I can't remember her name, but she had major regain. Um, Other than that, you really don't see it, even though it's out there. So one of the questions was, um, did your doctor mention that there could be regain? I had my surgery in 2003. It was laparoscopic RNY. I went through all the pre-op that was, required at that time. Did the psychological. I went to the pre-op support group sessions. Did a lot of research online. Read every single material my doctor gave me, and none of it said regain. None of it. It wasn't until after my surgery that I learned that there's a possibility for regain. I started going to the support groups for post-ops. And, after I start talking to some of those people, some of them had regained. They were out further than me, maybe for 3 to 4 years. And that's when I started hearing about it. Oh, you could regain. But I didn't regain. For a long time. I'm going to say about 6 years. I maintained. I never got really what I would call skinny. I never got skinny. I got healthy is what I did. My start weight was pretty high. I was up over 450 pounds when I had my surgery. Highest recorded weight, 477. Did I weigh more than that at one point? I'm sure I did. For years, I never got weighed. So, I don't know. I know right before I started the process of getting approved for surgery, I started dieting on my own even before my first appointment. And I waited for months for that first appointment. So, the first day I went into the clinic, I was 477. So, I know I had lost. And that was the first time I was able to be weighed in years, because my doctor's office scale couldn't weigh me. So, fast forward, I lost down to 233 pounds. That was my lowest recorded weight after surgery. That was a lot of weight lost. And I never stayed at 233 though. I hit 233, went up a little bit and stabilized at 245 to 250 and stayed there for a long time. I was there for over 5 years. No real problems. I followed the rules. I did everything that, my doctor said. I exercised, I worked out, I ate right, I did my protein. Stopped the protein shakes about 3 to 4 years out. Just because I was able to eat protein and didn't really need to drink it as much anymore. So my doctor was like, you don't need to be drinking them as much. So I did really, really well for a long, long time. About 6 years after surgery, I started to regain. And it was, I would say, insidious. That's the word I would use. Because it just sort of crept up. Before I knew it, I was 270. It just got higher and higher. And I stopped weighing. I had been a scale junkie. Was not on, I was always, every morning I weighed. I know that's not as healthy as it should be, but for 5 years it worked. And when I stopped getting on the scale daily, um, I stopped thinking so much about it and started eating more. Started eating more carbohydrates and sugars, and realized, oh my gosh, I don't dump as bad as I used to dump. When I first had surgery, even like diet things, would make me dump and would make me sick. So as the years progressed, didn't dump at all. Stopped doing that, and gained weight. So I gained a total of 136 pounds. And it was bad. It was, I don't think it was anything to do with the pouch. It was me, and it was not paying attention anymore, thinking that I'm like everybody else, or I'm like the majority of people out there that can eat a bag of chips and not gain weight. I'm not like that. So I have to be vigilant at all times. And I woke up, I guess, in May. Well, actually before May. And took out the scale again and got on it. And had to face the reality that I had gained 136 pounds. And had to reevaluate a lot of things. I had to go back to basics. Protein first, no drinking with meals, no major snacking, measuring food again. I had stopped measuring, because I thought I was just like everyone else. I could just make a plate and be fine. And that's just not reality for me. And so I'm back to measuring. So far I've lost, since May, 39.4 pounds of that 136 gain. So I'm on the right direction. Do I want to get, past that 136? Yes, that would be great. If I don't, that would be okay too, because I want to be healthy. It's not about a size. It's not about, being skinny. I never was skinny, never tried to be skinny. I need to be healthy. And so when I was at 233, I was off all of my medications in terms of high blood pressure and depression medicine and all that stuff. I was not on any of that kind of stuff. So right now I'm back on the blood pressure medicine because I gained so much weight that the blood pressure came back up. So trying to be healthy again. So I just am doing this because, weight gain, it's not inevitable. It's not something that, if I was a new weight loss patient, I would be stressing over. But you need to be aware that it is a possibility. It's very real, and it happens a lot. I actually belong to a Facebook group with a lot of members and who have regained, and we're struggling to get back on track and do what we need to do to go back to that lower weight that we were at one time. So that's it. I just wanted to put this out there because I didn't see, when I saw that topic, I was so interested in it and seeing what people had to say, and like no one had been through it, and it's such a hard thing to do and to go through, and to have everybody who knows you had weight loss surgery watch you regain it. And a lot of times they don't say a whole lot, but they're thinking it, well, that didn't work. But it does. Weight loss surgery does work. And so you really do need to just stay on track, and don't forget that, you are forever altered, and that the reason you went to that drastic step was because you couldn't do it the other way. Or if you did it the other way, just exercise and diet, it didn't stick. And so, the surgery is a tool But it's a tool you have to use every single day. And if you're not using it every single day, it's not going to work. So just keep on track, follow the rules every day, get your exercise in, your water in, your protein in, and it will still work for you. Even all these years later, I'm back on track, I'm doing what I need to do, and the weight's coming off. And it's not fast, although, 39 pounds in 3 months. I started on May 21st. It's not bad. Um, not a bad weight loss. But I'm not trying to be Speedy Gonzalez with the weight loss. I'm just trying to be consistent and, dedicate myself to the lifestyle that I used to have. It was so easy. It wasn't easy. I'm not going to say it was ever easy, but I got used to it. And for 5 years, I lived a certain way. And when I stopped doing it, the weight came back on. So as long as you follow the rules most of the time, I'm not going to say you have to be 100% every day. No one is. But if you follow it most of the time, you'll keep the weight off. And if you do regain, you need to start not wait like I did. Like I regained over 4 years. I slowly regained the weight. And maybe if I had thought about it or really realized, I could have stopped it earlier. So that's, my advice. If you start to see, the scale creep up, and don't stop weighing, even if it's just once a month, still weigh yourself so that you can be accountable to yourself. Because I didn't, I put the scale away and acted like it didn't exist. So on a happy note, I'm back on track. Everything is going really well. I'm losing. I feel better than I have in a long, long time. And hopefully, I'll be off these the high blood pressure meds soon. And I have a doctor's appointment in October, and hopefully my doctor will tell me, you've lost enough weight, your blood pressure is pretty stable, and it's lower, and we can get you off the meds. So thanks so much for watching. Please remember, never, ever, ever give up, and have a great week. Thanks. Bye.